Assalamualaikum and greetings to all. Did you know the statistic from the Befrienders Kuala Lumpur show there are more contacts received from people in distress and suicidal in the months of July, August, September compared to April, May and June? From this statement, I would like to take this opportunity to talk about mental health during the pandemic. Many of us did not aware that mental illness will become the second main health problem in Malaysia after heart disease by 2020. The COVID-19 pandemic had become one of the main causes of the increase of mental illness among Malaysians. This situation had led me to share more about the impact of COVID-19 pandemic to mental health, the way to handle mental health during the pandemic, and lastly, the society's responsibilities towards mental health issue. So let's move on to the first topic, which is the impacts of COVID-19 pandemic to mental health. The pandemic had caused a lot of people to start working from home, students with online learning, some people lost their job and income, and some of them even didn't get to meet their family. Those impacts can lead to stress, depression, anxiety, fear, and suicidal thoughts. This is because when having a drastic and sudden changes of environment because of the movement control order by the government, some people cannot tolerate and accept the new norm, as they will feel more loneliness, feeling fear, and sometimes they can have suicidal thoughts because they cannot tolerate anymore with this situation. For example, I like to share one case, which is a 50-year-old hawker was found dead in May because he was facing financial difficulties as he cannot work since the movement control order started in March. This leads me to the next point, which is how people can handle mental health during the pandemic. Firstly, people who suffer one of the mental illness should get help and advice from trusted organizations such as Befrienders, Talian Kasih, or access any clinics and hospitals. Next, one of the best way to handle our mental health during the pandemic is by maintaining a healthy lifestyle, such as getting enough sleep, eating healthy foods, and exercise regularly. Try to put away our mobile phones and any other gadgets and start to focus on ourselves. Other than that, try to do some activities that you like and enjoy, such as maybe cooking, baking, or reading books, or any other activities that you can have fun and you will have less stress. Now, I would like to turn to what society can contribute to help those people dealing with mental health issue. Society should always show respect, love, and acceptance towards the people who suffer mental illness in all situations and platforms such as media socials, schools, homes, or any other places. This can make them feel safe and accepted in the society, because the negative comments and perceptions towards mental health issue can trigger their emotions and can cause depression, anxiety, and even worse, suicidal thoughts. We should listen to their confessions to make them feel relief, and if the situation is getting worse, advise them to seek help from professionals such as psychiatrists or counselor. So, this concludes the focus of my presentation. To end, I would like to highlight people should read and aware more about mental health issue to stop the stigmatization of people who suffer mental illness is an attention seeker and or crazy people. The COVID-19 pandemic had really caused a lot of people to suffer mental illness because they need to go through a lot of tough and unpleasant situations. This clearly shows society play a vital role to take this issue seriously. That's all from me. Thank you so much for your interest and attention.